Today, we're talking about the Nipah virus, a rare but serious virus that continues to reemerge and make Nipah virus latest news, particularly with recent outbreaks in India raising global concern. If you search for Nipah virus symptoms, wondered how it spreads, or question whether this virus could pose a broader public health threat, you're not alone. Each time Nipah appears in the headlines, fear rises, often without clear, trustworthy medical explanation. And that's exactly why we're having this conversation today. The Nipah virus is not new. It was first identified in the late 1990s, yet it remains one of the World Health Organization's priority pathogens because of its high fatality rate and lack of a widely available vaccine. While outbreaks are usually localized, their impact can be devastating, especially in healthcare workers and close contacts. Recently, India has reported new confirmed cases, particularly in the state of Kerala, prompting renewed surveillance, isolation protocols, and public health alerts. These outbreaks remind us that infectious diseases do not disappear simply because they fall out of the news cycle. I am Dr. Miriam Martin, board-certified emergency medicine physician. In this video, I'm going to walk you through what the Nipah virus is, why these outbreaks in India matter, how the virus spreads, what symptoms to watch for, and what practical prevention really looks like, without panic, misinformation, or exaggeration. As a physician, my goal is not fear, but clarity, because informed people respond with wisdom, not anxiety. Scripture reminds us in 2 Timothy 1:7, "For God has not given us a spirit of fear, but of power, love, and a sound mind."
What makes Nipah particularly terrifying is its high case fatality rate, which can range from 40% to 75%, depending on the outbreak and the region. So since that initial discovery, outbreaks have primarily occurred in South and Southeast Asia, particularly Bangladesh and India. The natural hosts for Nipah virus are fruit bats, specifically those from the Pteropus genus, often called flying foxes. These bats carry the virus without showing any sign of illness. So how does it spread to humans? Primarily through three main routes. Number one, direct contact with infected animals. In the Malaysian outbreak, pigs were the intermediate hosts. Pigs became infected by consuming bat-contaminated fruit or sap and then transmitted the virus to farmers through close contact. Number two, consumption of contaminated food. In Bangladesh and India, a common route is the consumption of raw date palm sap contaminated with bat urine or saliva. Bats love to lick the sap from collection pots. And number three, human-to-human transmission. This is a significant concern. Nipah can spread directly from person to person through close contact with an infected person's body fluids like saliva, urine, or respiratory droplets. This often happens in healthcare settings or within families, highlighting the need for strict infection control. It's important to clarify something right here. The Nipah virus is not easily airborne, such as measles or COVID-19. But close, unprotected contact can still transmit infection. That's why infection control practices matter so much in healthcare and household settings. So the symptoms of Nipah virus infection usually begin several days to 2 weeks after exposure. Early symptoms may seem nonspecific and include fever, headache, fatigue, muscle aches, nausea, or vomiting. At this stage, symptoms can resemble other viral illnesses. But in some people, the illness progresses. More serious symptoms can include cough, difficulty breathing, drowsiness, confusion. And in severe cases, encephalitis, seizures, loss of consciousness, coma. Some people who survive may experience long-term neurologic effects. That is why early medical attention and supportive care are critical. How is Nipah virus diagnosed? Diagnosis requires specialized laboratory testing, which would include PCR testing, blood tests, imaging studies of the brain. Because early symptoms can be vague, diagnosis depends heavily on exposure history, clinical judgment, public health coordination. This is why transparency and surveillance are essential in outbreak response. Treatment options. At this time, there is no specific cure for Nipah virus. Treatment is supportive. That means managing breathing, controlling seizures, reducing brain swelling, providing intensive care when needed. As you can see, this virus is potentially very, very serious. Researchers continue to study vaccines and treatments. Until then, early detection and prevention remain our strongest tools. Prevention includes avoiding consumption of food potentially contaminated by bats, using protective equipment in healthcare settings, early isolation of suspected cases, and community education. For most of you watching this video, the risk remains very low. But wisdom is staying informed, not ignoring reality or feeding fear. In Matthew 24:6, Jesus says, "You will hear of wars and rumors of wars, but see to it that you are not alarmed." Emerging infections remind us to stay alert, not afraid. Preparedness is not prophecy. Surveillance is not panic. Knowledge is not fear. When faith and understanding walk together, fear loses its power. If this video helped bring clarity, share it with someone who may be anxious or confused. And remember, your health journey is not just physical, it's emotional, mental, and spiritual. Stay informed, stay grounded, and stay at peace. This is the medical message on Call for Life, where faith meets medicine. Be sure to click the link and subscribe to the medical message. See you in the next video.